Hello and welcome to Askimo TV. I'm talking today to Julian Rowe-Jones. Dr. Rowe-Jones is a consultant nasal surgery specialist at Royal Surrey Health and Hospital in the UK and director of the Nose Clinic. Hi, Dr. Rowe-Jones. How are you?
Hi, Joanne. Good to see you.
Lovely to be talking with you today. Dr. Rowe-Jones, let's talk today about the deviated septum. What is a septum?
The septum is a structure inside the nose that acts to give us a right and a left side. It's like a partition wall inside the nose. And most importantly, on the outside, it supports the lower half of the nose and creates the bridge for the lower half of the nose and supports the nasal tip and keeps it in the right position.
What happens when the septum becomes deviated?
Two things can happen. One, it can cause blockage inside the nose, so you feel that your airway is restricted on one or both sides. And two, it can also be associated with a change in the shape of the nose externally, a flat nose, a twisted nose, a boxer's nose, a huge variety of different cosmetic change.
What are the causes for a deviated septum and who's likely to get this condition?
Injury is the most common cause of a deviated septum and therefore most commonly seen in contact sportsmen such as rugby players in the UK, boxers of course, but it can happen in the playground at school, any cause of injury really. But some people are born with a twisted septum. It has been suggested that when we're born our nose gets squashed on the way out and that might give rise to a twisted septum later on in life, but we're not sure about that.
How are deviated septums diagnosed and treated?
The first thing to do if someone thinks they may have a deviated septum is to look inside the nose. Careful examination with a good bright light will show whether the septum is twisted and more importantly where it's twisted. And complementary to that is carefully examining the outside of the nose to see if there are any twists externally or dips in the bridge of the nose. So those are the main findings.
And the treatment if you do find the septum's deviated?
To be sure, first of all, what the patient's hoping to achieve, and that would either be one or both of improved breathing through the nose and improved appearance externally. The surgery is infinitely variable because the deformities are infinitely variable. They can range from a simple repositioning of the septum inside the nose, a septoplasty, through to full septorhinoplasty, where the position of the tip is altered, the contour of the bridge is altered, and the straightness of the nose corrected, as well as the breathing on the inside. So it can range from simple septoplasty to complex septorhinoplasty.
If you are having to perform one of these treatments, what should or couldn't patients do in order to recover as well as possible post-op?
I perform the surgery under general anaesthetic. I must say I don't pack the nose. It's very unpleasant for patients to have packs in the nose, and it's unpleasant particularly for them to be removed. So I try to tailor the surgery to avoid having to pack the nose. But nevertheless, what tends to happen is when the patient comes around from anaesthesia, they feel their nose is fantastic, clear, the best it's ever been. But over the next 3 to 4 hours, it congests on the inside, and they start to notice it's starting to become congested. They start to have to dab their nose because it does bleed a little bit. That's normal. And the following morning, they think they've developed a heavy cold overnight, and that settles over about 2 weeks usually. So I would usually advise a week off work and maybe a week working from home the second week if possible. But it's not beyond the realms of possibility for them to go back to work a week later.
Thank you, Dr. Rowe-Jones. Thank you so much for talking to me today.
My pleasure.